Thanks for tuning into Vital Motion Podcast. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits into your life and check in with your healthcare medical providers as you feel is necessary. Thank you so much, and I'd love for you to like and subscribe to my channel. Happy listening.
Welcome back, everybody. This week we are joined by Grace Allen, a Virginia Tech alum and Doctor of Physical Therapy student. We're in the same program, and I've always admired Grace, so I asked her to come on the pod. And today she's going to join us for a discussion about her background. We're going to talk a little bit about like athletic training versus physical therapy, and then actually get into her background with neuroscience, which is super cool. So, yeah, thanks again so much for coming on, Grace. And let's start by getting to know you.
Yeah, thank you for having me. I'm super excited for today. My name's Grace, and like Madison said, I went to Virginia Tech. I graduated in 2024, I think, May of 2024. And I studied cognitive and behavioral neuroscience, but my path through college was kind of all over the place. But I ended up really liking neuroscience, and still to this day, I love it. And I shadowed as a sports medicine student aide was my official title for the Virginia Tech track and field team for 2.5 years. And basically, I shadowed under their athletic trainers and got a lot of hands-on experience with track meet coverage and just getting to know the athletes personally. It was so much fun. I loved it. I loved all my athletic trainers that I worked with.
I love that you were able to spend so much time with like the athletic trainers, especially because it's so similar to what PT is about. So tell us a little bit, because I know before you came to PT school, I think you took a gap year. So tell us a little bit about that, what you feel like you learned about yourself. Do you feel like it was worth it? All those things.
Yes, I am a big proponent of gap years. I also experienced a lot of burnout, I guess you can say, in undergrad. So I didn't think personally that I could go straight from undergrad to grad school. So I gave myself a year just to take some time off from that, which I don't regret at all. I got to travel to South Korea
Oh,
and
cool.
Italy during my gap year, and that was fantastic. So I was born in Korea, South Korea,
Mhm.
and I finally went back to visit my family, and I stayed there for a month, and it was so much fun. I got to practice my Korean, which was nice. I just got to see where I like originally was born, so that was cool.
Yeah.
Yeah, yeah.
That's great to like go back to your roots, and especially like you said, like the burnout after undergrad, just taking time to just like truly not use a brain cell.
Was so nice. And I know some people in their gap years they like to work as like PT techs or
Mhm.
whatever or something related to physical therapy or whatever grad school that you're trying to go to. I chose not to do that personally because I was like, well, I'm going to school to be a physical therapist and I'll be doing that for the rest of my life. So
Right.
I want to take this one year truly to for myself. But I did work. I worked as a swim instructor. I did that
Did
when
you
I was
swim when you were in grade school?
I did. So my parents put me in a whole bunch of different sports, but I really stuck with swimming. And I did it up until about eighth, ninth grade. And
Hmm.
then I quit because I wasn't that good at it, in all honesty. And I was like, yeah, I don't think I can compete at like a high school level. So I just stopped doing that. But I ended up teaching swim lessons for the team that I swam for.
Sometimes it's more fun to like be a coach and
Yeah.
like teach people how to do stuff
Yeah.
than, eventually when it comes to a point with sports. I was the same way. I'm like, I'm not really doing this because I'm good at anymore. I'm just doing it for social hour.
And
But
like my level of skill was like, eighth grade, like it ended in eighth grade. So I'm not teaching, like I'm not coaching like college athletes or anything. I'm teaching like 3, 4 year olds, which I loved. So I did that during my gap year as well when I wasn't traveling.
that's awesome. I guess in a way, I kind of took a couple gap years, and I never thought I'd go back to school. But then
Hmm.
after, I feel like I graduated from JMU in 2021, and then
Okay.
worked as a PTA after I did a year program for that. I was like, I'm set, I'm good, I don't need to go back. And then
Yeah.
just kind of fell into my lap where I was like, you know what, I'm just gonna do this now. I always felt like in the back of my mind I sold myself short. Not that like being a PTA, I don't regret it, but um it's just like funny how your journey kind of warps into something that you never expected.
Yeah, exactly. What made you want to be a PT or go back to PT school?
Honestly, I felt like I was gonna hit kind of like a ceiling with PTA.
Mhm.
And I kind of like the idea of being able to eventually maybe work for myself or I don't know, work in a school setting, maybe bring some more opportunities that I would have maybe capped out at as a PTA. Not to say that there are some PTAs that end up being clinic directors and stuff like that. I also was just kind of craving like more knowledge. There's a lot of like knowledge gaps, I feel like for me that have kind of overlapped from PTA to PT. So
Mhm.
it's been really great to just kind of like build on the foundation I already had. So
Yeah, that's super cool.
yeah.
Yeah.
Yeah, girl. Okay, so we talked a little bit about how you were the sports medicine student aide. Tell us a little bit more about that. What ultimately led you to maybe choose PT over the AT path?
Yeah, so I hit like a wall in my sophomore year of college because originally I was a clinical neuroscience major.
Mhm.
And basically in our program, all the clinical neuroscience majors are kind of funneled into like medical school or some like PA, NP, like grad
Mhm.
program. But I just didn't think that that was for me. And so I was like, well, I don't know what I'm going to do with my neuroscience degree if I don't want to go to med school. So I switched over to cognitive and behavioral, but I also explored a double major in now it's called like exercise kinesiology or something, but at the time it was called human nutrition, foods, and exercise. One of the requirements for that major was to do like a field research study kind of thing. And so that's how I found the sports medicine club because that like our rotations with the sports teams counted as like a credit for our major. So on my initial semester doing that one field research study was we went around to 6 different sports teams and you shadowed their athletic trainer for like 2 weeks. And you would go in for like practice times or whenever you could basically, and you would just observe. I loved, loved, loved my 2 athletic trainers that were there. And
Mhm.
they were like the best teachers ever. And I had so many questions and they were so willing to like answer all of them. But they let me like practice a lot on the athletes that were willing to let me practice on them. And so yeah, at the end of my 2 weeks, they were like, Grace, if you want, like we would love to have you as a full time. And then the following year, so my first semester of junior year, my fall semester of junior year, I started being a official full time for track. So over the 2 years, I got to travel with them. I got to travel with the team. I got to watch the rehab process of like a couple different athletes from the beginning of their injury to the end. And also just getting to talk to them about their mental headspace while they're rehabbing and like the ups and downs of it because, progress is never linear, right? And so there
Mhm.
are always setbacks that are happening. And just to be on like the personal end of that is really cool.
Mhm.
Um,
Definitely.
and people would know like once I got comfortable with a lot of the athletes, like they would ask me either to like stretch them out, cupping, anything like that. And then if they had like a rehab program, I would walk them through that. But usually athletes, like you show them an exercise once and they're like, okay, I got it. You don't need to help me. So
Right.
so
Yeah.
my job wasn't really to like coach them through their rehab, I guess, but I helped out with more
Mhm.
of like the manual stuff. And then if we had a track meet, I would just set up everything for that. So like Gatorade, coolers,
Yeah.
ice packs, anything that they needed, I would be there to get.
That's awesome that you got to do like some hands-on stuff that really correlates well with what we're doing now. And so ultimately, were you thinking in your brain that you were going to go AT after you graduated?
Yeah, so I loved it. And I was actually looking at AT programs to apply to. I ended up touring University of Central Florida and
Yeah.
for the athletic training program because the original athletic trainer that invited me to be a full-time, she went there and again, love her, bless her. So I went but ultimately what made me decide that athletic training was not for me was that they work so hard, all the athletic
Hmm.
trainers across all the sports, and
Hmm.
they don't get a lot of recognition. And I didn't like that because
Hmm.
they are always there for their athletes and they are first line of treatment, like on the field coverage. And they know their athletes personally because they're always in the training room all the time. And they're
Hmm.
like the biggest advocate for their athletes. And but they just don't get that recognition. And I thought that I
Hmm.
didn't think that that was fair. And on
Hmm.
top of that, not only do they not get recognition, they don't get adequate pay either. And their hours are limited to the team practice time. The idea of a 9 to 5 job is really enticing because, you only work 9 to 5 and then you get to go home and you don't have to bring your work home with you, kind of thing.
Right.
Um, so I wanted something that was like a 9 to 5-ish, but also kind of similar to athletic training, and that's what I think PT is. Um,
Yeah.
although you can find PTs in sports settings.
Yeah, definitely had those same thoughts when I actually took an athletic training class at JMU and I was like, I love this. This is great. I feel like they should be more considered like emergency service, because
Yeah,
they're on the spot, like
right.
treating those athletes, especially when they get injured, like during a game. Like you said, they just don't get the recognition that's due for them. The good thing about AT and PT is it does overlap a lot and we do a lot of similar things. So,
Yeah. Yes. And all my athletic trainers, and not even just the ones that I worked with personally, the ones for all the sports were so cool. Like they're the coolest people ever. And kudos to
mhm.
them because they do a very, very important job that a lot of people don't even know about. So, yeah.
Mhm. Definitely, for sure. So how has PT school going, by the way? What do you feel like is your biggest, like, maybe takeaway from year one so far?
It's going good. I really enjoy it. I mean, there has been like ups and downs, obviously, as with anything in life. But I think what has helped me keep focused on like why I chose PT in the first place was asking to shadow in our clinic downstairs. And so I did that last semester with Dr. Wheeler, and she
Hmm.
is outpatient orthopedic physical therapist, and I liked her patients. I liked working with the same people like every time I went in there. And now this semester I'm working with Dr. Riley, who is a neuro physical therapist. And I think like getting exposure to being in the clinic and being with patients again has like again kept me focused on like why I chose PT in the first place, because I think when you're focusing on your studies and like your head is in a textbook or like your head is in a lecture or whatever, you can get lost of like it gets overwhelming, it gets hard, and you're like, why am I doing this? Like, what is the point of this?
Hmm.
Um, so yeah, I think reminding yourself being in the clinic has helped a lot personally.
Yeah. No,
Uh,
I love that. I
yeah.
love that you are especially like shadowing different therapists that specialize in different things. So
Mhm.
you can, start to build that rapport with like patients
Yeah.
and what maybe like, walk yourself through like what certain treatments look like. So
Yeah.
that's awesome.
Yeah. And it gives a lot of like the things that we learn in class, it puts it into context because I think when you're learning about random pathologies or exercises or protocols, it's hard to retain that information when there's not like a patient in front of you that you're working with that has those pathologies or that has to adhere to these protocols. And so it's nice to put two and two together, basically.
Definitely. It's very hard for me to visualize certain things unless I like have a background of it or I
Mhm.
do it. So
Yeah.
I'm really excited to get back into the clinic this summer so I can kind of like, almost like airing out everything that we've learned and just like really testing the waters to see where we're
Yeah.
at. So,
Yeah.
but okay, so we're going to talk about some neuroscience stuff, the brain. So, leading into that, what is something about the brain that like surprises you or that would surprise people?
Someone can dedicate all 75 years of their life to learning the brain, and they would not even cover the surface of what is
That's
happening. And I think like what people don't know is that neuroscience as a field is so, so new. It's like a baby. It's only been like 100 years, not even, of like
Hmm.
formal neuroscience research as we know it today. And even before then, when people were studying anatomy and just studying the body, like modern day neuroscience wasn't really starting until like the 1880s when Ramon y
Hmm.
Cajal, they created the neuron doctrine. And I think we learned this in neuro, but the neuron doctrine just basically states that every neuron is an individual entity and that they have their own structure, that they do their own thing. And so, from 1880 to like now, that's still less than 300 years, I think, off the top of my head. But compared to a subject like math or physics, like those have been around for so long, and neuroscience is
Hmm.
just getting started. So there's so much more that we have to learn or have yet to learn. I also think that people underestimate the brain or their own brain, and I think people underestimate their own
Hmm.
body in general. Um,
Hmm.
so yeah, everything's surprising about the brain, to be honest.
Yeah, no, it's really fascinating. I mean, especially I've done a little couple of deep dives just like related to like pain neuroscience and how our brain is like essentially kind of playing tricks on us a little bit. And so we
Yeah,
kind of have to constantly check it and be like, no, this is not true or whatever.
yeah,
So when you put that in perspective, like 100 years is not a long time,
yeah.
it seems like a lot, but it's really not. And so like related to like, I guess trauma. Did you learn about like how trauma like affects people, whether that's like physical or mental?
From like a psychology perspective, there are so many things that are happening in the brain all the time, and there are a lot of different mental health disorders or like addiction, or just general like psychological biases that we experience as humans that determine how you react to things and how you behave. For example, I took a neuroscience of drug addiction course, and drug addiction is both a mental and physical thing. Like your brain is like being physically rewired, and there's neurons that are dying, but also like synapses that are getting stronger because some of the pathways in the brain are getting reinforced of like, okay, I want to look for this drug or I want to look for whatever. When it gets to that point, like let's say someone's addicted to nicotine, I guess, because that's a really prevalent thing, and especially in our age group, I feel like at some point there will be harmful behaviors that this person with a nicotine addiction expresses or
Mhm.
exhibits, that they will put themselves in a precarious situation, but they don't care anymore about that because what they care about is nicotine. I guess that's more of an extreme end for nicotine, but I think it would make more sense if you talk about it in terms of like heroin or
Mhm.
cocaine or stuff like that. It's like at some point, these people are going out of their way to seek that drug, and they are like pushing their friends and family away. They
Mhm.
don't care about their health and safety anymore. All they care about is just finding that drug because that part of your brain, the reward system in your brain, has been so reinforced. It's like, I need to get this thing to feel a certain way or to feel
Mhm.
baseline. So something
Mhm.
like that obviously changes your behavior a lot. But also, just psychological trauma can change it too. Like in terms of ACL rehab, like you said, there is a psychological principle called the confirmation bias, and it is basically your brain is looking for information that confirms what you already think about yourself or others or the world. And so if you go into an ACL reconstruction and you're like, oh my God, my life is over. My career in this sport is done. I'm never going to get any better or I'm never going to get back to where I used to be. Then your brain is going to be like, okay, yeah, we're done. Like, but that's it.
Mhm.
And so I think no matter how hard you try in rehab, if your underlying core belief is that you will never get back to what you used to be, or
Mhm.
like you are washed up per se, then
Mhm.
it's gonna show. Your brain is going to like reinforce that whether you like it or not. That piece of information is really powerful because then you can use that for good too, right? If you go into it and you're like, okay, all these doctors, all these physical therapists, my athletic trainer is going to do everything in their power to help me get back to where I need to be, right? And you put their trust, or you put your trust in them, and you put your trust in yourself, right? Then I think your outcome will be a lot better. In summary, neurons that fire together wire together. And
Mm.
what this means is that the more you use a certain pathway or the more you excite certain neurons, the synapses get stronger. And that goes into neuroplasticity. I don't know if you know what neuroplasticity is.
Tell us, tell the listeners.
Yeah, so neuroplasticity is basically your brain's ability to adapt. And this happens throughout the course of your lifetime. It's a little bit weaker when you get older, but it's still happening.
Mhm.
And so, like, another principle is use it or lose it. So, like, let's say you're trying to learn Spanish and you learn Spanish from when you were in high school and you were really good at it in high school. But then when you went to college and then afterwards, there was no need for you to use it. And then now you're like 27 or 30 or whatever, and you
Mhm.
come across somebody that you want to speak in Spanish because they don't know English. Because it's been
Mhm.
so long since you've used Spanish, you are not going to remember it because it's been 10, 20, 30 years. And those neurons that were responsible for your recall of Spanish, the synapses have died off because your
Mhm.
brain was like, oh, we don't use this. So it's taking up space. So we don't need it
Mhm.
anymore, right?
Hmm.
But you can apply that in terms of like the confirmation bias as well. If you're constantly thinking of, oh, I'm so bad at this, or like, oh, I'm never going to get this right, or I'm never going to understand this, then that thought process, that pathway in your brain is getting reinforced. So those synapses will get stronger. And then the synapses of the thought processes that are responsible for things like, oh no, I'm really good. Like, I am smart. I am capable. I can do this. Or like, my ACL will recover and I will go back to sport. Those neurons are like, the synapses are dying off, right? So if
Mhm.
we want to
Mhm.
switch that, we can be like, we can go into things with a better mindset. Even if you
Mhm.
don't like truly believe it at first, the more you keep telling yourself, the more those neurons are firing, the stronger those pathways are going to get. So yeah.
It's kind of like a constant, like, it's almost like our brains are like babies, and we constantly have to tell the brain, like, no, this is how you do this. This is how I think or feel, and not like almost let those intrusive thoughts win.
Yes, exactly. Yeah.
But that's really hard to do. It's easy to stay almost like in that negative mindset and like
Hmm.
feedback loop. It's really hard to sometimes be more positive, especially, after a something like an ACL rehab because it's such a
Right.
long rehab process. But I mean, I think that could just be like with anything. Like we have to kind of bring ourselves back to like, no, we can do this. We're not gonna fail just because we think we're gonna fail. So
Yeah.
that's really interesting.
Yeah. And I think like another thing too is that biologically your brain is meant to protect you and to protect
Mhm.
your body. And so failure is something that's very scary. And so your
Mhm.
brain is like, oh, well, if I think that I can do something, or I think I can go back to sport, or, like I can do all the things that I could do before my ACL surgery, what happens if you do fail? That's a very scary thought. So I think it's easier for us to stay in like um, to keep ourselves smaller, I guess, because then there's no chance of us failing or putting ourselves out there and getting hurt, right? So that I think that's kind of like the default of like your brain is like, no, everything is scary. If you just stay right here, like you'll be safe. But yeah, so
Mhm.
it's definitely like a conscious process that you have to go through,
Mhm.
but worth it, 100%.
I feel like the idea of like not being afraid to fail, like how do you feel about that? Because I feel like that's kind of pushing that boundary of our brain being like, no, I don't want to do this, but sometimes almost we have to fail to experience success, if that makes sense.
Yeah, I agree. I think it's more of like a exposure kind of thing.
Hmm.
The When you've never failed in your life, the first time you do fail, that's going to be the scariest thing ever, right? But if
Hmm.
you put yourself out there and you're like, okay, let's say you failed once and the consequence was just, oh, you just have to try again, right? That's
Mhm.
not bad. So then,
Right.
so now in your brain, you're like, oh, okay, we did this, but all I had to do was just try again. That's not bad. So then you
Mhm.
try again, and let's say you fail. But again, the worst that can happen is you try again.
Mhm.
So I think the more you do that and the more you like tell yourself it is okay to fail, the easier it gets. You're adapting to that scary thing.
We always, see this like motivating mindset stuff, but I feel like it really is true. You always have to be putting yourself in uncomfortable positions and
Mhm.
setting yourself up. Maybe not failure is the best term. Maybe it's just like not going the way that you planned and then
Hmm.
adjusting and trying again and hoping that it just continues to adapt and change. So,
Yeah.
any other thoughts you have about the brain that maybe would relate to
I
anything?
guess one misconception that I've heard just in my family of like when you get older, it's like, oh, your brain is slower and like I can't
Mhm.
learn anything anymore because I'm old. And there's some truth like that our body is degenerating as we get older, right? But I think
Mhm.
just reinforcing the fact that like neuroplasticity is something that happens until the day you die.
Mhm.
The rate of which that it's happening, it does get slower when you get older, but that doesn't mean that it's not happening. And so
Mhm.
even if you are like 60, 70, 80, you can still learn a new skill. It's not too late. And you can still train your brain to think certain ways. I feel like people underestimate themselves all the time, and I hate it. It's my pet peeve of like when someone's like, "Oh, I can't do this thing," and I'm like, "No, you can. Like you
Mhm.
can. Your body is so much more capable of everything that you can ever think of. You just have to not be afraid to try."
Right.
Yeah.
Definitely. I mean, I'll just use the example of like playing pickleball. Like I
Hmm.
never did that when I was a kid. And so now when I play, it's like I feel like I'm back out when I was maybe like, 7 or 8 and things feel awkward and clunky. But
Hmm.
the more that you practice and the more that you play, your body picks up on that and you're like playing like a pro, you know?
Exactly.
It's the same
Yeah.
thing with, and I'm always for like new experience and trying new things. So I feel
Hmm.
like that's also important. It's just to be open to trying things, even if you feel like you're gonna hate it. Most
Hmm.
of the time you end up having fun and you're like, why didn't I do this sooner?
Yeah. Yeah, I agree. Oh, something just came to mind actually. There's
Yeah.
a research study, or I heard we learned about it in school, where there's a lot of research around Alzheimer's disease or dementia in general. And a big thing that helps like prevent it, or not prevent it, but like slow it down, I guess, is learning or doing puzzles.
Hmm.
You're not, I mean,
Hmm.
realistically, you're not going to be like 75 and become absolutely 100% fluent in some random language that you've never heard of, right? But just
Right.
something as tiny
Right.
as like playing Sudoku or like doing word searches
Hmm.
or doing puzzles, just something that makes your brain work a little bit harder and like problem solve is so helpful with in patients with Alzheimer's or dementia. And so it's just little things like that. Just keep your brain active. It is a muscle. It's growing, it's evolving, it can shrink, like, but you have to keep using it or else you will lose it. Yeah.
Definitely. Yeah, the use it or lose it principle is a real thing.
Yes.
And I feel like that's what kind of happens maybe sometimes when people retire, is it's
Hmm.
like they're using their brain all the time and then they go to like not. I feel like that maybe leads to like a quicker, degression sometimes for some people,
Yeah.
especially if they're maybe not active in their community or socializing or whatever the case may be. So
Yeah.
I definitely feel like we have to keep moving, we have to keep learning forever.
Yes. Agreed.
It's just like fitness, It's not like we're trying to get to like a certain point and stop. Like it's a
Hmm.
constant journey of like training and changing and adapting and doing what feels good and
Yes.
just getting movement. I have one qualm with physical therapy because I feel like we go through this whole rehab process and then most of the time we're like discharging patients and we're done. Like they're done. But in reality, people end up coming back and seeing us more and, for a certain issue or the same issue. So I feel like it almost needs to be like a continuum of like, okay, we're done with PT, but let's set you up for the next thing, like let's set you up for a gym membership or whatever the case may be, so that we're encouraging them to not lose their progress they made, if that makes
Right.
sense.
Yeah, I agree. And that's
Um,
that's where patient education is so important.
Definitely the power of patient education, for sure.
Yeah.
But yeah, I mean, I also think sometimes it's just like the way insurance is set up too, people only get a certain amount of visits and then it's like, well, that's all we can do for you.
Yeah.
Um, so, but hopefully things will evolve. Maybe we can be that generation that, encourages people to continue afterwards, like you said, with patient education and stuff. But
Yeah, that would be
okay, anyway, to
awesome.
kind of wrap things up, is there anything else you want to talk about related to the brain?
I think that was my big spiel. Yeah.
I love it. No, that was really educational, so I appreciate that. Grace is very into athleisure wear, so she's gonna drop some of her favorite brands for us. She's always got the most fire outfits.
Oh my gosh, you're too nice. You know, currently, or like for a while, I've loved Gymshark and they have
Uh,
such good sales. So I always shop on their sales. And I've tried Able and I really like their leggings. So I have a
hmm
few of their leggings and compression shorts. Um, I don't know. I want to try Honor Active, but I have yet
Ooh,
to. Their leggings are really, really expensive, and I don't have
yeah.
that kind of money right now. So whenever I get that kind of money, I'll let you know how it is. But but yeah, other than that, Gymshark, Able, Old Navy. People sleep on Old Navy, but they have
They
some good
do.
sick stuff. I love them.
Yeah.
Yeah, those are my main ones, I think.
Well, you have always have it together in that department. So,
Thank you.
um,
You're too nice.
keep doing what you're doing. I actually find that Walmart has some good stuff too. Now they carry Adidas, which is nice.
Oh, okay. I didn't know
And
that.
it's also a little more affordable, but just like Old Navy.
Yeah,
Love shopping their like 50% off sales. So,
yeah,
but anyways, thank you so much for coming on today, Grace. Loved our discussion, and yeah, hope you all have a great rest of your day, listeners.
yeah. Thank you.